Hi, this is a very short video on topical steroid use. Topical steroids are commonly used for rashes that are inflammatory in nature. The inflammation can come from immune system cells or from the cells themselves. There can be an inflammation within the cell. Steroids work through mechanisms mostly going to the nucleus of cells and affecting receptors at the nucleus. They vary in potency. They can be from very low potency used on the face, in folds, to very strong potency used in rashes that are sort of resilient to change, such as psoriasis. This is sort of the breakdown. Minor allergic rashes, and there is an over-the-counter hydrocortisone cream, 1%, which you might use. And you can use these on the face where there's intertrigo or chafing between the skin and folds. You find medium potency steroids used for atopic dermatitis and eczema, those immune triggered rashes and immune itchy rashes with histamine release, and other immune mediated rashes. Strong potency steroids are reserved for psoriasis, severe poison oak, alopecia areata, which is where the hair falls out from usually a stressor of sorts, an immune trigger. Nummular eczema, which is a coin-shaped lesion, eczema, allergic type rash there, and discoid lupus and some other rashes. So it's important with all rashes to try to use the rash to determine the underlying cause, to understand if it's nutritional, dietary, non-dietary, allergic, systemic, or infectious. In nutritional causes, frequently vitamin D deficiency, we know, affects the likelihood of autoimmune disease and therefore probably has an effect even on your immunity within the skin. Vitamin B3 is nicotinamide and niacin. Nicotinamide can be taken as a supplement. And there are other videos on both these topics. And the beta carotenoids are very important because they are part of the innate immune response. They respond to protect the skin from bacterial infection, and therefore you have a higher rate of infection if you're not getting your beta carotenoids, brightly colored vegetables and fruits. Allergic rashes from food. Well, first of all, histamine-rich foods can cause histamine-rich skin, therefore itchiness, swelling, redness as a response to the foods that are ingested. That can cause a histamine-rich environment for days when you ingest histamine-rich food. Scrambroidosis is a well-known food poisoning from fish. Broiled fish or fish that are left out in the sun can cause scromboid poisoning. Those are histamine-mediated poisoning, and there's various degrees of it, but many other foods can be high in histamine. Besides high in histamine foods, some people have underlying ongoing allergic reactions of some sort. We won't call them allergies because allergists and immunologists have classified allergies specifically, but clearly they keep your immune system responding to things otherwise it wouldn't. And these typically include things like gluten and soy proteins, dairy proteins, some of which are similar to gluten. The nightshades are a group of plants including tomato, eggplant, peppers, both the chili peppers and the green peppers, and potatoes. There are other nightshades. And other dietary triggers. You may know for yourself which do it. Non-dietary allergic things, a famous one on the West Coast is poison oak. There's also poison sumac and poison ivy. Fabric softeners frequently will cause immune flare-up, and new fabric softeners, new detergents are highly suspect for a more systemic rash or one that is in the distribution of clothes. Systemic rashes, we must be concerned of insulin resistance and diabetes setting a person up for higher risks of bacterial infections and yeast. And immune deficiencies, of course, of concern. Hormonal imbalance can precipitate rashes, frequently do. Of the infectious rashes, fungus is most common. Frequently people have perianal itching, which partially can be a fungal infection. And also viral exanthems or rashes seen often in children, but also in adults with a virus common. We'll also see rashes to drug rashes, which might respond some to steroids. In simple plan, well, you can use a steroid for a rash. We should use the rash to try to understand the underlying cause. If you use a steroid because of tachyphylaxis or developing a tolerance to medication, it's best to use steroids 3 days on, either once or twice a day as directed, and then 4 days off, or 4 and 3, and repeat this until the rash goes away. If it goes more than a month, you should come back, and we will either change the diagnosis and the medication or refer you to a dermatologist or if I feel the rash needs a biopsy or I don't feel I can diagnose it, I'll send you right away to a dermatologist. Very good. Hope this helped. The PDF is very important. It gives a list and the most economically beneficial of these topical steroids. Thanks. Bye.